there's several ways of studying. Do the module, learning, then stop. Download your PDFs. Do the module learning, stop. Download the PDFs that will provide you for the module. Where's the module? The PDF is located under the first video of each module. You have a PDF for the entire module, like module 1. There are 23 small videos there. So you download the PDF, and then you stop. Now you go to the question bank, and you do all the question bank for module 1. Then you stop, review your PDF, and then you start module 2. You do all the videos of module 2, stop, download the PDF, and do all the question banks on module 2. Now, as you go to module 3, you should already be continuously revising module 1 and 2. You arrive to module 3. You do the same thing. As you move to module 4, you're going to revise module 1, 2, 3, and 4. And then finally, we arrived on module 5. Module 6 is our crash course review. Every single thing that's said in the crash course review, it's important. You know, it might be just one phrase, or we'll not make a slide on one phrase. It's just high yield content. You need to know that you should take everything for face value, what's said on the crash course review. Then you repeat, you do the test on module 7, 10 days before your real test, which should have been in your mind. This is my real test. You take module 8, which is the PMHNP crash diagnosis test number 2. If you do that, you have done 1,400 questions. You have covered all the material. You have revised many, many times the PDF. And you have validated in a test format. We cover all the basics, way more the basics. We went to like high level of super, almost very difficult not to pass. Right? Now,
Gotcha.
Go ahead, please.
Oh, I'm sorry. I was just going to say, as you're talking, I was going to ask this question. I'm looking at the 30-day review, and I'm not finding the actual PDF file. So I've gone to each one of the modules, and it's supposed to be at the end, and it's just not there for me to print. I'm not finding it.
So it is under the first video of each module. As right under.
First video of each module. Okay, that's my mistake then, because I'm just looking at the entire X number of video, looking at the very end. So the first video, got you. Okay.
Of the first module, because that will be where instead of giving you 23 downloads, I'm going to give you one download with 23 videos on the first module. So I'm trying to make it easier for you instead of a download.
Understood. Okay. May I ask, have the PDF files been rewritten at all since, a while ago? Have they been modified? No, they haven't.
No, what I'm doing is rewriting in question format. Instead of talking about the front lobe, I'll say, give me 5 functions of the front lobe. Give me.
Okay, but the PDF files are basically the same, because I printed them out a while ago, and tonight as I'm following along, I'm finding a lot of parts that are skipped, but my pages might be out of order because I did drop my binder at one point, so that might just also be my pages aren't organized. I'm gonna have to go through them, but I just wanted to make sure I had the correct current information for this module. Thank you so much. I apologize. Thank you. I didn't mean to interrupt you. Thank you.
Yeah, no problem.
Dr. Lopez.
Guys, if you have questions for the question bank, please email me, because I can't really do it now, or if you can't log in for whatever reason. But what is your question? How can I help you?
I just need a clarification. And this is not about, what we're doing right now. It's about the scale. And I'm always confused with the MMSE. Like when we say the MMSE and the norm is 10 to 20, I mean the moderate is 10 to 20, and so therefore it always throws me back. When I see 18, I count it as regular. Do you start medication at that point?
Are you talking about the MMSE or
SE,
the?
correct. With the slump, like when they said, oh, this patient visit a physician and the MMSE is 18. And I
Okay.
know between 10
So
and 20.
let me do a what's called a Socratic. Thank you. One second, Bena. Bena, 1 second, please.
Isn't that in the other module?
Adam, what's the reason we do a MMSE?
Is
To assess.
Yeah, let her answer the question,
to
please.
assess the patients
For
to see
what?
if they have any dementia or.
Okay, so we're assessing for cognitive dysfunctioning, right? So
Yes.
that we are assessing for dementia, and the under dementia, the bigger umbrella is Alzheimer's, right? So
Yes.
in that case, it's not about safety per se, like, oh, highly suicidal, right? So that would be the mental status examination. So what I wanted to bring up, the point is people confuse the MMSE and the meaning in the mental status examination.
Right.
Right? And people confuse too other scales. When you say suicidality and things like that, do I provide medication or do I assess for safety? We are looking at the PHQ-9, we're looking at GAD-7, we are looking HAM-A, HAM-D. Does it answer your question?
Kind of. So you're
Yes.
saying what? So
Go
you're
ahead, please.
so you're telling me if the patient has an MMSE of 18,
Okay.
is what?
So what does that mean then? Well, if you have
That's a
18?
moderate. That's a moderate scale.
Right. For cognitive.
Right.
So go ahead, please.
And so therefore, if another physician have checked that patient and say, oh, this patient have Alzheimer's,
Sure.
so I clarify that the patient does not have Alzheimer's, or as a moderate, you can say that patient has, it's the beginning of Alzheimer's.
Sure. So I think the question you asking can be put in a different way. As in, you receive the patient with Alzheimer's diagnosed by another physician. And now you reassess, and the patient MMSE or the Boston test is 25. Which of the following should I do? Well, you're going to give the diagnosis that you assessed, which if it's 25, 23, 26, the patient does not have, likely not to have a dementia condition. And first, I think you asked about medications or assess for safety, which implies other scales.
Correct.
Okay. Yeah, I wanted to make the clarification of these things because they're important. Bina, please give me a second and we'll go back to your question, okay? So we can get going here. But please save the question, and I would like to answer any of your concerns. If it's okay with you, proceed.
You're talking to me or you're talking to me?
It was Bina. I think she had the question too.
Oh, okay, okay. Yeah, go ahead.
Okay.
Yeah, sorry.
Sir, I didn't have no question. I was calling my daughter.
Oh, okay. So never mind. All right. So one way, there'll be cases in psychiatry, and you need to know. One way of doing this, there are several ways. You can memorize Tarasov versus Reagan, or you can just call it the Tarasov principle, because they will never put that Tarasov versus the Ford case, right? So one way to save brain power is by just the first or the last name of the case. Start with that. Now, the Tarasov principle gets a lot of people. And the reason for that is that it is a case that's well known in psychiatry. And anything that's well known in psychiatry is likely to be on your test. So in this case, it says the duty to warn. And that's the problem here. Remember, the test is about the standard of practice. It's not about what the scope of practice is in California or in Florida or in Maryland. It's about the standard, the bigger umbrella done by ANA. In that case, the duty to warn may or may not apply to your state. In that case, what do we need to do? Find out. Whether finding out from, in that case, you find out from your state board of nursing if applies. So you're getting the bigger umbrella, understanding that there is this case court, and you live in California, and the answer is like calling the state board of nursing would be applicable because you want to know if it applies to you or it doesn't. And that for that reason, answers like that broadly would be applicable. Answers that are broad, that means for all states, calling the appropriate authority, I didn't say who, appropriate authority, or calling the police, most likely be the right answers, because you can never be wrong with that. That's a umbrella big answers. Okay. Now, immediately calling the boss, immediately calling the friend or the family member, it could be wrong because this may not be what you should do in your state. So that's more specific. If the question says you live in California, you consulted or you read the regulations or you know the regulations of California, it implies that the terms of principle now is applicable, or of your state. It would not say probably California. It would say of your state. It would be because it's applicable to everyone. So now immediately, now the answer would be more warn the person that might be a danger. Okay. So number one, terms of principle means duty to warn. Number two, answers broadly, calling your state board of nursing, calling the police, calling the authority. Number three, if it's a specific, if it goes in details or implies that you have done all your homework, now it's more likely that the answer to be calling the person at danger. Okay. Now, what is habeas corpus? It basically says it's unlawful to detain anyone without a due process, meaning that a lot of statutes in mental health protects the patient against being held in a hospital unlawfully. So basically, if I'm a patient and I am being held and I believe that I shouldn't, just because I have schizophrenia, and I say, hey, I want to see the judge, and I want my cases, my protection of habeas corpus should be brought to the judge, and the judge will decide whether I'm able to leave or not. So what I'm saying to you is that a mental health disorder alone is not enough for admission. I don't care if it's schizophrenia. I picked the highest one, right? What I'm saying to you is that in order for me to be admitted, I have to be a danger to myself or others. In order for me to be admitted, I have to not able to cope in society, meaning have something to eat. I have to protect myself. If I'm deemed unable to do so, then it is, you can force that and say no, because you're not able to protect yourself or others. But if the patient says habeas corpus, I need you to know what that means. You cannot withhold someone without due process. All right, we covered two cases and the examples. Connor versus Donaldson. I just call it the O'Connor case. O'Connor case, I'm going to give an example, was someone that was held 15 years in the hospital because he had a mental health condition. It wasn't dangerous to self or others, but the hospital said, no, man, sorry, you can't. You have this condition. You can't go nowhere. And finally, this case went to court, and it was ruled out that mental illness alone cannot be confined against their will. if they can survive outside. Mental illness alone can be schizophrenia, cannot justify involuntary or involuntary hospitalization. So we cover terrorists off, duty to warn, when and how it's applicable. We cover habeas corpus, what it is unlawful to detain anyone without due process. O'Connor versus Donaldson, or just the O'Connor, cannot detain anyone only because of mental health if they are not dangerous to self or others. As you see, they all say similar things, but with few nuances in between. If you wait to memorize these cases the week of the board, it's likely that you get them confused. So start practicing those cases early. Early in the presentation, module 1 or module 2, I said the patient has 3 rights. And one of them is informed consent. What's the other 2 rights of a patient? Least restrictive environment, right? We'll cover another one in a second. Just don't want to jump the gun here. But least restricted environment, informed consent, right? And the Patient Privacy Act, but we'll keep that in a second. So least restrictive environment and informed consent are patient's right. And I need you to know that specific. The reigning that's claim, it says, has the right to refuse treatment and use in appeal process. So questions on this, so it's like, patient is schizophrenic, involuntarily admitted. Does he have a right to refuse his olanzapine, chlorazil, whatever? Yes or no? Involuntarily admitted with schizophrenia.
He have a right to refuse any treatment.
Yes, but that seems odd if you don't prepare yourself mentally for those types of questions, because the patient was involuntarily. Someone right now will be thinking, no, because he's involuntarily and he has schizophrenia. I know someone is thinking of that, right? So the Rainey versus Klein says the patient has the right to refuse any treatment and use an appeal process. And then what would likely happen is the hospital is going to take this case to the court and the court will decide. But for now, the patient says, no, I don't want that medication. I said no. Then we have the Roger versus Oking, or just the Rogers case. Basically saying, hey, patient have the right to refuse treatment, but I am only 16. Mom says, do it. Then you, as the healthcare provider, is going to be like, hey, you're going to take this medication because your mother said yes. Roger, this is O'Keen. It's similar to Rainey case, but now my mother said, hey, I have to, the mother authorized, so we'll go ahead and give it, right? So as a provider, if I have someone that's 16 years old and he says, hey, I don't want any medication, I said, okay, no problem. Call the mother, like, hey, this is the situation, right? Obviously, we have a consent. We can go in details. What if the patient doesn't give consent and so forth? In this case, it's not really applicable because the mother is the one that has the consent. Anyways, now I'll call the mother and says, hey, Maria, John here doesn't want to take his medication. What would you like us to do? I highly advise that he should take this medication to get better. Yes, go ahead, please give the medication. So in that case, I can give the medication. So the difference between Rainey versus Klein versus Roger versus O'Keen is that Roger says, I can refuse the medication, but my mother, if my mother says yes, then the medication will be given. The Rainey case is more like an adult says, hey, I don't want this medication, I can refuse it. Then we arrive to the Durham versus USA. It says that individual is not criminally responsible if the unlawful act was due to a product of mental illness at that time. You can have schizophrenia and you can commit a serious crime, but during the crime, you were lucid. You knew what you were doing. This was premeditated, or you had a clear mind to conduct this crime. But the German versus USA is the biggest case where we get in debates all the time. It says, hey, I know someone that did X, Y, and Z, went in jail and stay in jail. They didn't care. We should not get in the details here. Basically, it's saying if the crime was due to a mental health condition actively at that moment, serious enough to make that patient unable to distinguish right from wrong, then it's likely not to be held responsible. Okay? Well, Ford versus Wainwright, or simply as the Ford case, the patient must be competent to be killed, executed. Close to German, but if my patient is not lucid, he should not be sent to the death penalty. Okay? And very similar, we are not going to get in the detail. Take full face value here, because you could go, is that means he cannot be killed now? And we're not lawyers. I'm not lawyers. And every case is different. Okay? You can think of Ford cannot die as a way to remember that he cannot be executed if he's not competent. The Stark law is money under the table. Stark law gives me some money under the table. Basically, I cannot refer a patient due to monetary gain. Hey, I know that the brain surgeon, he's one of the best. And your case here sounds like you need this treatment. I think you should go see him. And then the neurologist will give me some money on a side, right? Under the table. This is illegal, should not happen. In practice, we see a lot of this with pharmacy or pharmaceutical companies that pay student loans. Hey, if you'd like to provide a little bit more of X medication, I can make the student loan disappear. Then you work for the company or provide samples to the patient. Work for the company is not a problem here, right? If you work for the company, in a sense that you can be employed by the company to provide education about the medication is not a problem. But you should not be seeing the patient and referring only or the majority of the time that medication that's made by this company in which you receive money from. Provide samples to the patient or provide company sponsors education and get paid, right? It's a conflict of interest to the patient here, right? You can do this to other providers because they are providers that need to know of that, but then you disclose that immediately in the beginning of your statements. Hey, I work for this company. Today's presentation is about this company, and I want to inform you that I am receiving compensation for this. Okay. So Stark law, money under the table. Ford cannot die. German, individual cannot be criminally responsible if he was not if he was due to a mental health disorder. Roger, you can call it, hey, my mother says go ahead, the medication is okay. If it's under 18, patient can refuse. But if a mother says it's okay to give the medication, give it. Rainy case, any patients can refuse treatment. Two patients' right, least restrictive environment, and informed consent. What else? Stark law, money under the table. Example, pharmaceutical companies. American Disability Act of 1990, it says you have to, especially, I'm not going to get in details, there is a certain number of employees that the company may need to have it. And generally speaking, someone with a disability should not have unfair treatment, right? For hiring, firing, promotion, and so forth, right? And that means in all places, right? Restaurants, governments, entities, private practice, but there is nuances about that. All what I want you to know is that it protects people with disability for the entire lifespan. If they have the disability that's, blindness and severe back pain or whatever might be the disability, right? They're entitled to reasonable accommodation, meaning, hey, if you are an employer and then you have a certain numbers of employee and your employee requests, I can't work because this back pain, and requests reasonable accommodation, that could be a nice, comfortable chair. That's a reasonable accommodation. Maybe more frequent breaks if needed. Okay. Not getting too into detail, what you need to know, ADA, is that people with disability should be treated fairly, equally to others, and accommodated for their disability. So they can work. Go ahead.
Dr. Lopez, I'm sorry. I just wanted to backtrack momentarily to the Ford versus Wainwright. I work, I think I probably mentioned this, for the state of Illinois on inpatient psych with, my patients are all from Department of Corrections. And the legal term for what the Ford versus Wainwright is referring to is unfit to stand trial. So if they're unfit to stand trial, they have to achieve a level of competency based on multiple assessments over a period of time to ensure that they've been stabilized medically, that they fully understand what they're being charged with before they ever go to trial. So the USTI is the legal application to that. And for the Durham versus US, that's not guilty by reason of insanity, not criminally responsible if the unlawful act was the product of mental illness. Then they're found NGRI, and then they're sentenced according to whatever the law allows within the context of a mental illness.
Perfectly.
I would just say that because I go to a lot of treatment team meetings where we discuss these legalities. So
yes,
I mean, if anybody finds that helpful, maybe you could also consider, USTI or unfit to stand trial for Ford versus Wainwright, and not guilty by reason of insanity for Durham versus the US.
Perfect. Yes, those cases are important. It's likely that you may see them because they're well known in psychiatry, right?
It's very common. They all claim that. They all claim their
so
NGRI.
one way. Thank you, Kim. I appreciate the
No problem.
explanation there for sure. TURPs is a one-way. TURPs FUS is one way to remember because it says the T, the terrorist off, duty to warn. H, remember, you need to know the definition of habeas corpus, so it's protect against unlawful detention. The O is the O'Connor case. The R, the patient has the right to what? Least restrictive environment and informed consent. The P is for the Rainey versus claim, the right to refuse or perfuse treatment, right? And then we have the D for the Durham, not criminally responsible if the act was due to mental illness, without getting too much in detail, right? F stands for the Ford case. Ford cannot die or stand trial here to be executed. S is self-referred, and that is for the Stark law, right? Stark law, money under the table. Specifically, usually comes with the pharmacy cases or gaining any kind of monetary. Again, we are not going to go in detail. For some states, getting a lunch is totally fine. Getting a $25 gift is totally fine. There is a certain amount and how much is possible, right? Talking about much bigger money. And the S is for simple. That's a conflict of interest with the pharmaceutical companies. All right. So these are mnemonics. Others out there. Pick what works for you. Okay. So one way to do this is the legal land of mental health metropolis. A renowned judge named Torpifas upheld the law that with a just and fair hand. His ruling were always guided by the principle of the acronym PMHNP. So let's go over again. The T is the Tarasov principle. And we said duty to warn. We know now when to call the State Board of Nursing. We know when to call the police. We know that the questions are specific. That says you read the regulations and anything like that, it's more likely that the Tarasov principle is applicable. In that case, you do duty to warn. Habeas corpus means to protect the citizens from being unlawfully detained without a due process. Okay. Then we have O'Connor. In his courtroom, the judge, PFAS, decreed that mental illness alone cannot justify involuntary hospitalization. Okay. Echoing this case. The R is for he championed patients' right. What are the two patients' rights? Insisting on least restrictive environment and informed consent. The preface means this judge upheld the right to refuse treatment. What case are we talking about? Rini versus Klein. Durham ruled that the individual were not criminally responsible if the act was unlawful due to a product of mental health condition, right? Guys, this has to be severe enough, not just, oh, I have depression and everything is in context, right? Ford, remember, Ford cannot die. We talked about that. That's S for self-refer, money under the table, Stark law, and S here for the sample was vigilant against influence of the pharmaceutical company. I don't want to go into too much detail. We'll go a little bit more details in the course, but just want to give you a little bit of synapse of this acronym. May I please have anyone that could read this question for me? Okay. In a recent outpatient consultation with a PMHNP, a patient displayed aggressive behavior towards his boss during a heated argument that escalated into a physical violence. The patient later expressed an intention to cause harm to his boss upon returning to work. What would be your appropriate action as a PMHNP in this case? A, reach out to the patient's employer to address the potential for a dangerous behavior. B, ensure the patient agrees to a no harm agreement. C, firmly discourage the patient from contacting his boss. Or D, contact your state board of nursing to assess potential risk. Now, who thinks is A? Everybody got to pick an answer, though.
D.
I do.
Okay. All right, so you think it's A. Good, thank you.
I think it's A.
Okay, perfectly said. Who else thinks it's A?
A, because you had to warn.
We have two A's. What else? Who else thinks it's A?
I will go for D. I will go for
Okay,
D.
so we have three and more. Let's move on. B.
A.
Who thinks? Okay, guys, 1 second, please. Who thinks is 1 second, guys, please. Ensure the patient agrees to a no harm agreement. Who thinks it's B?
Nope.
Nope.
Nobody. Doesn't a no harm agreement sounds good? No? Okay. Who thinks it's C? Firmly discourage the patient from contacting his boss. I don't think you should contact your boss. This is not a good idea. Who thinks it's C? And the rest of you guys pick D. Consult with the state board of nursing to assess the potential risk. Now, let's read this question again. In a recent outpatient consultation with a PMHNP, you, right, the patient is in front of you, A patient said, hey, I had an aggressive behavior towards my boss, and we had a heated argument, which involved physical violence. Now, I really want to cause harm to him, and I'm returning to work tomorrow or later, immediately after here. So now, did the question say, who thinks is A, and tell me your rationale?
I think it's A.
Go ahead, please tell me why.
The rationale would be because, I mean, he's already told you, he's already made a threat. It went from physical violence to then he made a threat. There's no reason, well, for me, you need to warn the employer because he's going to go to work and try to, do the action.
Okay. Perfect. I like what you said.
And
Now let's go
also,
back
you
here.
have the duty to warn the boss.
So you have the duty to warn the boss, right? Okay. I like the
Mhm.
way you're thinking.
Doesn't apply to all states.
Okay.
But they,
Yeah.
I like the way you guys thinking. So guys, if we don't work, we give very specific example. That's confusing.
But
Very
he
confusing.
didn't give the consent.
But remember, what did I say about the Tarasov principle? Does it apply to every state? Yes or no?
California.
No.
Only
it does not.
California.
Oh, no. Hold on. I'm sorry.
No,
I never
it
said
does.
it's only California. I
No,
just gave California
no.
as an example. I don't even know if it
No.
applies to California. I just gave it like an example. So in that question,
You
it
were very
didn't say
clear. You said
anything.
consult the
Hold
board.
on, guys. So let's break this down. It didn't
Yeah.
say anything about what state. We are taking a national board. And I said the Tarasov principle is duty to warn. And I said duty to warn, your choices are calling the police, calling the appropriate authority, and calling the state board of nursing. Exceptions when the question says, hey, yesterday I had a violent interaction with my boss and I really want to harm him and I'm going to work tomorrow. And then the rest of the question says, as a PMHNP, that clearly knows your state regulations. So here I want you to switch the answer because it's saying, hey, I know what my state would do. It is indirectly applies now to the Tarasov principle, duty to warn. Okay? They will never say in the question that the duty to warn applies. Because if it does, then you pick, that would not be confusing anymore, would it? It will cue you in, as in you clearly know your state's regulations and you know the laws that apply to your state. It may give you a little bit more or may not, but in that case, it's saying, hey, I know what's applicable, and it is assumed that if you pick the Tarasov principle, it's applicable to your state. Now, again, we're talking about national standards versus scope of that state, of what you should and should not do in the state. The question is nationally, right? For the national certification as a psychiatric mental health nurse practitioner. Your state will decide what you can and cannot do in the state.
I have a question.
Yes.
Okay, so so then what happens if like you looked up your state's regulations and it's saying that you cannot warn, just the scenario, and then
then
you did
you call the police.
okay.
Yes.
You call the police, because calling the police, you can never be wrong.
Okay.
I can call the police and say, hey, I love my dog. Okay, Dr. Love, that's not a good reason to call the police. Sure, but I'm not wrong to call the police. I can call the police for anything I want. Not saying it's appropriate. I can call the police and say, hey, I had a patient that told me X, Y, and Z. Okay, thanks for letting me know.
Okay.
I can never be wrong with that. So that's
Right.
why these protective answers, you cannot be wrong. If I say, call my state board of nursing, I can never be wrong. I can call my state board of nursing any day and get clarifications. So these are protective answers that are encompass everything else, umbrella answers, right?
But what-
It's like saying reading or writing. Another answer for that will be literacy, right? That encompass many parts of being able to understand.
Dr.
So
Lopez,
go ahead.
no, may I ask, so as I'm looking at these options, really, to me, the most appropriate option is to notify the authorities. You wouldn't necessarily want to tell the employer, because if the employer reacts negatively and says, you know, gets a gun himself and he's going to take this employee out before he can
Yep,
do something,
before he takes me,
you
right?
could be escalating the violence. So
Oh, yeah.
I guess it's kind of like when you're starting out in nursing after being in nursing school. There's the right way to do it and then the way we actually do it. So how many people would actually call the State Board of Nursing? Probably in real, I mean, not a lot.
None.
So
But
I would think
but
that
again, we
the
are
right
protecting
answer is to
ourselves.
notify the police
Right.
instead of the
So,
employer.
but here's the thing.
Somebody's got to get notified.
Yeah. So we cannot ever do this mistake that we're doing right now, is reading to the question, implying this case or my state or my situation or my hospital, how I do things, because how I do things, it really doesn't matter in a sense of a bigger picture on how everybody does and collectively, right? How I do things, it really, you know.
Well, but wouldn't it be prudent and safe to notify the police to have them intervene as opposed to the nurse going
Okay.
directly to the employer?
Yes.
Because
So
you may
is
have
this
an
an answer choice?
unprecedented response from the employer that you wouldn't anticipate. You don't know him.
Okay.
He doesn't know anything about
Kim,
psychiatry.
Kim, you're reading to the question.
I am. I've made an entire
yeah.
novel out of this. I'm sorry.
So yeah, you're reading to the question. Is that an answer? Is that on one of the options? Calling the police?
No, but it should be.
So that's it. So it should. But will the board ever give you what they should? Never. Will the board ever give you all the characteristics of a diagnosis? Never. What they'll say at the end of the question say most likely diagnosis. So at one point we have to turn the key and accept that they will never get the full answer or the full details to make a concrete judgment. We have to make a judgment here with the information that we only have written in the scenario. Given that my scenario may not be fully comprehensive, but you will not get a fully comprehensive question and the answer in nowhere, none of the 175 questions. Because if you did, it'll make the case super easy.
I have, forgive me, I have this same question from a previous PDF file that you had written and I downloaded quite a while back. And the question is stated as, in a routine follow-up session with a PMHNP, a patient informs the practitioner that her spouse has expressed a desire to end his life. The first course of action should be alert the husband's employer, inform the husband's relatives, advise the patient to check on her husband, or contact the local authorities. So if we're looking at a differentiation between harm to self or harm to others, this current question is in the context of harming others, but I think it's a parallel to the same answer of contact the local authorities.
It is. But what's the other possible answer? So you are choosing to make one answer
I'd like to
because it's the most correct answer, but the answer is not given to you.
I know.
What I'm trying to say, I'm preparing you for wishy-washy answers that are also acceptable. I'm not denying that calling the police, it is the best answer for both, right? But
Yeah.
would that
Well, it's not on the test. You can't
those
give
two
that
answers
answer.
would never be in the same answer choice. What I'm saying is that because it's a national test, calling your state board of nurses is also appropriate. In that case, you have a duty to warn if it's applicable to your state.
Yes.
Okay.
That's a given.
So guys, I insist that you fight the urge to make your life a little bit harder than it is, because we can come up with much better example in questions. That's not a question, right? So, but what I'm saying here to you is there is a certain ways that we do things for the test. In life, you know, you do what's appropriate for your state. Right?
So, Dr.
Then you
Lopez,
find out the duty to warn, or you can call I would call the cops in any state. That would be my first reaction.
Absolutely.
Right? But
That was
there
the
is
right
an
answer, although it
option to
wasn't
find- there is
provided.
an option, if it's applicable, duty to warn. That's all we have on here.
Understood. Thank you.
Yeah. So a routine follow-up, and thank you for those that picked A, I think was A, the answer, because it's more important that you get it wrong than it is important than you getting right. Because when you get wrong, you remember.
Thank
When
you.
you get it right, it just might just go away and you get it wrong on the testing, right?
So Dr. Lopez, Dr. Lopez, I
Please.
have a question. So should we know our state policy before we go into the test?
No, because it's a national test. You don't need to know
National,
about,
so- okay.
because the test cannot apply to California, Florida, Maryland, or any state. It has to be national. It's the standard of care. And
Standard.
applicable, overall laws applicable. Now, the state will tone it down or tone it up, however the state wants to do it. That's the scope of what
Okay.
you can do in that state. So you don't need to know anything about, because if you did, I would be out of luck. I would have to study 50 different states and laws, right? Impossible. It's impossible alone to study national laws. Much, much
So
more
the
difficult.
answer, so the answer is A.
No, D.
I don't remember what
I
was the
thought
answer.
the
The answer
Definitely.
is
thought
D.
it's D,
The
but
answer
you
is D
said-
because you can't go to the employer.
Right.
Yeah,
because
that's
you
what I
may
thought. But I thought I
Escalate
heard
a
you
further
said,
problem. So you need to confirm with what's correct in your state or
Yes.
national applies. You have a duty
So-
to. That's the bottom line.
Yeah, duty to warn. If it's applicable to your state, you can do it. That's an option.
yeah,
Sarasota principle, three beautiful answers. Call the state board of nursing, call the police, call the authority. Basically, it's saying, hey, let me find out more regulations about what I can and cannot do.
yeah.
Few safety answers, police and authorities, however that's you want to peel that out.
Okay.
Now, the same question, if it goes in details that it finds out that kind of cues you in that you know your states and board and regulations and that you are aware of the law, it's unlikely that it would be duty to warn, advise the boss, call the police, and call the state board of nursing, right? It can only be one answer. Okay? So what I'm saying is that when to call the boss, when the question clearly or makes you think that you know your state regulations and it is applicable. And in that case, it would not be call the police an option. It would be something else. And duty to warn the boss would be most likely applicable.
Oh,
Okay.
here's the question. The one I just read from a different PDF. Sorry.
Okay.
I got ahead.
So,
Sorry.
all right.
I
So
see
we
it.
actually just covered this one, right? So we just covered this one. In a routine follow-up with the PMHNP, a patient informs the practitioner that her spouse has expressed desire to end his life. So here we have a different situation. Now I'm dealing with secondhand information. I don't even know who the spouse is. What I'm going to do, I'm going to call the state board of nursing. Hey, what do I do here, guys? Am I incorrect? No, I'm not saying it's the best choice, but I'm not incorrect. I can also call the police, which would be the safest and best option. Okay? What I would not do is call immediately the boss or whoever and report that. Okay? All right. If a patient has been involuntarily hospitalized and refused to take his medication, what course of action should be taken? A psychiatric patient in the involuntary status can not refuse medications. B, psychiatric patients do not understand what's best for themselves. C, psychiatric patients can refuse medication even in the involuntary status. D, the nurse must use sound clinical judgment. That sounds good. And insist that the patient take his prescribed medication. I don't know the rest of that. So one thing here, task taking, for answers to be right, has to be the whole complete answer. So anytime you have and, but, if, blah, 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 you have two complete answers by connected each other. Make sure the two answers in the answer question is complete. Right here, D, clearly, we have a complete answer, good, umbrella answer. The nurse must use clinical judgment. That cannot be wrong, right? It's for everything we have to do that. And insist you shouldn't insist the patient to do something he does not want. So let's
Yeah.
cross that out. So is it, what answer would be?
C.
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 Okay.
Harley.
What case would that be applicable?
Because the patient always has the right to refuse.
What's the name of the case?
If it was child,
Corpus corpus.
it wouldn't.
It's habeas corpus, right? No, forgive me. No, that's not
If it
it.
was child,
It's
I-
Rennie.
All right, 1 second. Let's see one by one. Rebecca, what case would that be?
Rennie Klein.
Rennie versus Klein.
Randy. Okay. Let me
Thank
pick
you.
somebody else. Who said orbis corpus?
I did.
What does it mean?
He has a right,
Orbis corpus.
patient has a right to be.
Due process.
Due process, yeah, involuntary, hospitalized without due process.
Okay. What's O'Connor means?
O'Connor, he has
Let
a
her
right
answer,
to
please.
be,
Go ahead.
okay. Too much study, okay. O'Connor, has a right to be, as long as he's not a danger to self and
Perfect.
others, yes, he has a right to be discharged or something like that.
Oh yeah, he should not be held.
Against his
Should not
will.
be held if
Against-
he's not a dangerous self or other, right? Help
Yes.
in a hospital. I mean, all right, guys. So the reason why we do questions are unrelated is because I want you to recall what you learned. Because we can stay here all day, but if you don't remember what you learned, then it's good, very good, very little benefit for you, right? So now we'll be going to our module 5 training number 4, and then we'll take a break.
Dr. Lopez, excuse me. I missed the
Go ahead.
previous question answer.
Okay.
The previous question, and the answer I missed it.
Oh,
Just
the
before.
previous answer was to call the police because it was the husband saying my wife or something, or the spouse
Yeah.
saying my spouse said X, Y, and Z, and the answer was calling the police.
Okay, thank you.
Okay. All right. So now we are going to talk about informed consent, which is one of the patient's rights. Don't confuse confidentiality versus informed consent. So now, if you think as a nurse, as informed consent, we always think before a surgical procedure, but it's really applicable to anything that we do, because informed consent is nothing but a communication between you and the patient that says, hey, do you accept or do you reject this treatment? You have options, by the way. Allows the patient to make a informed decision. Thus, it's called informed consent. It's the right of every adult and emancipated minor. What's the other right that we talked about? Least restrictive environment. So what is an emancipated minor? Basically someone that is younger than 18, that is married or self-sufficient and live away from home. Okay? So it's important to know what an emancipated minor is, because we can get one of those questions and say, Mary is a 15 years old emancipator minor. And then we can twist that question to make you get the wrong answer. And you see how would that play out. Right? So informed consent is nothing but the communication between you and the patient that says, here are your options. So we are going to talk about the treatment, the nature of the treatment. What are your alternatives? You can get acupuncture, or you can get light therapy for depression. The benefits of using SSRIs are lasting. 70% of the people may never need medication again if they do the correct treatment over 12 months. 30% will need it again. Now, opportunities for questions. What are you thinking that I could help you answer any of your questions? And the risk for SSRIs that males may have a sexual dysfunction and female may have a elongated, more difficulty achieving orgasm, right? So I just give an example of informed consent in a nutshell for a simplest consultation possible. I give the nature of the treatment, alternatives, the benefit of the medication, opportunities for questions, and the risks involved. And that is your informed consent must be signed. So in order for someone to give informed consent, you got to cover those 5 principles. I cannot hear you. Can you unmute yourself?
Guys, can you please mute your phone?
Yes, if you are, I cannot see you, so I just heard someone talking. If you're not actively speaking, please mute your phones. You can use the acronym CARE for informed consent, which basically comes down to communication, acceptance, the right of the patient, and the E for emancipated minor. I have not seen a lot of questions that discuss this point of emancipated minor, but I can see how we can tweak a question from right and wrong by having that in the question. So it's important to know your law cases and how an emancipated minor could trick you to get the wrong answers. So again, in order to give informed consent, for the person to give you informed consent, the patient needs to be competent. They have to have competency. You need to disclosure of the treatment. They need to understand. You cannot force them. Have to be voluntarily. And they'll give you the consent, yes or no, to proceed with the treatment. Okay? So it's simple. Before someone give you informed consent, ask, is the patient lucid? Can the patient answer the questions? Can the patient ask questions? Do the patient understand the treatment being offered?
Question on this topic.
Yes.
It's so straightforward. First question comes to mind is how can the state make that tricky? The CARE, informed consent section.
What do you mean the state? That's a standard of care.
Well, I mean the exam. How can the exam mess
all up?
You
are going to see, I think there is a question that's coming up and you are likely to see the answer in a second. So let me go back to that and we'll make a tricky questions on this.
Okay.
Many tricky questions I just out of my mind start exploding questions right now. So I can make so many tricky questions. Understand that easy concept as the test makers, they can tweak something that's so easy in something hard. Never get tricked by it. So throughout this presentation has been talking about 3 and 2 patient's right. And mostly I said patient has the right for informed consent and least restricted environment. But the third one that I also mentioned here and there is confidentiality. So in your mind, when you hear what are the patient's right, number 3 should come up and should say confidentiality, informed consent, and least restricted environment. Did I say privacy? No, because confidentiality is different than privacy. And we're going to tweak that a little bit to make more confusing and clear to you. Patient has the right to confidentiality. Patient does not have a right to privacy. Wait, we'll come back to this. Okay? Least restrictive environment, and we talked about the reigning versus claim right. So patient has the right to refuse treatment, even if it's involuntarily admitted or a psychiatric condition. So, can someone read this question for me, please? Anyone?
If a child is 7 years old, their medication order must be approved by their parent. Which of the following elements of informed consent does the child not meet in this scenario?
All right. So I want you to stop here and ask the core of the question. What would be the core of the question?
They're asking you about informed consent. So which option does not meet that?
Yeah, perfect. So we're looking for a reverse answer. We know what informed consent is. Now, in my mind, I'm looking for the one that's not informed consent.
Oh,
I can tell you that 10% to 5% that could easily be a 10 questions we are missing because of this concept of reversing. So when we make questions as test makers, we know what you know, and I'm going to reverse that and see if you can catch this not needing or not part of, usually not what would be included in informed consent. So usually be some except, not, all. These are the things that you have to be mindful. I just want to clarify, you don't want to interrupt you, stop your flow there, but please continue kindly.
You want me to give you the answer?
Answers A, B, C, and D, and pick your answer choice, please.
I think it's if I ignore the, I think it's D.
Okay, so what answer A? Autonomy versus veracity. So I have a minor.
Oh, I missed
I
it.
think
I'm
I
looking
know
for
it.
not meeting. Hey, I don't want to change your answer on my intonation of voice. I just want to kind of like work
Yeah.
through the question. So it's a minor, not meeting form. Guys, 1 second. Let her answer. She volunteered. So the child does not meet informed consent. What are the elements you should be thinking that I need for an informed consent, and which one is this child not meeting? So we're working through the question rather than picking an answer that sounds good. So is a 5 years old, does he have autonomy versus veracity?
No.
No. Okay, so this kind of doesn't meet. Okay, so we can put interrogation mark, is not a strong answer. Would you agree? So now let's take a B. Does the patient have capacity and comprehension? 7 years old.
No.
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 Okay. Does
Right
the patient
answer.
is informed consent? 7 years old has to do with confidentiality versus beneficial.
No.
No.
No. Is this the disclosure of information and voluntariness?
No.
No.
Oh, it is because it is part of informed consent and the patient is disclosing information and voluntarily. But is it stronger
But
than
that's not the
capacity
best answer.
versus right? So what would be the answer? So I think you know the answer, but I want you guys accustomed to working the answer, right?
B. Answer
It is
B.
boy.
Okay. So now I think everybody agrees the B would be the not. It doesn't meet the scenario, it doesn't meet the consent. And all of you guys knew this answer. All of you. All you had to do is work the answer. Right?
Yes.
Anybody think, oh, I completely didn't know this answer? But if we jump the gun and immediately look at the A, B, C, and D, this can be a hard question. It can be confusing, but we have to get in the rhythm of working those questions so we'll get those easy points. This is not an easy question, by the way, but the patient clearly at 7 years old or whatever it was, 5 years old, it does not have capacity. And in order for someone to give informed consent, they need the capacity. Now, I think it was and it was not Kim. I think it was who asked the question? How can you make informed consent tricky? We just did, right?
I think it was Kim.
It was Rebecca, right?
No,
Asked
it
the
wasn't
question.
me. I didn't ask the question. This
Yeah.
is Kim.
So we just made an easy topic into a hard question. But if we get in this habit of working the question, we actually know a lot more than we think we know. All right. So it is 7:55. We'll be back at 8:05 p.m. Eastern Standard Time, and then we'll walk through the last bit of Module 5. Okay.
And you promise that we know more than we think we do, right? That's a promise.
That's a promise. You just gotta work it. Everybody knew this answer.
Yeah.
But the way it was presented and the way we jump into picking one that may sound good, it's is the part that we have to break it through between comprehension and application, and then like tricky questions, right? Everybody knew this answer, but if we start working the question, it become much more manageable. We were like, okay, which one is the strong answer? Does the 7 years old have capacity? No. Is capacity needed for informed consent? Yes.
Yes.
Right. All right, we'll be back.